Dermatitis herpetiformis DH is a chronic skin condition characterized by intensely itchy and blistering rashes, often associated with celiac disease. It is considered a skin manifestation of celiac disease, the condition in which the immune system reacts abnormally to gluten, the protein found in wheat, barley, and rye. While DH itself is not caused by a viral infection despite the name herpetiformis, the rash can resemble herpes lesions, which is why it's called herpetiformis. Key features of dermatitis herpetiformis: location of the rash. DH commonly appears on areas like the elbows, knees, buttocks, back, and scalp. It can occur symmetrically on both sides of the body. Blisters and itchiness. The rash consists of clusters of small, raised blisters that are extremely itchy. Scratching can cause open sores and scabs to form. Gluten sensitivity. DH is closely linked to gluten sensitivity and celiac disease. People with DH often have an autoimmune reaction when they consume gluten, leading to damage in the small intestine as well as skin manifestations. Chronic condition. DH is typically a long-term condition, though symptoms can come and go. It can be managed effectively with treatment and dietary changes. Symptoms of dermatitis herpetiformis. Symptoms can vary in severity, but common signs include severe itching. This is usually the most bothersome symptom and can occur even before the rash appears. Blistering rash. The rash consists of small, red bumps that may turn into fluid-filled blisters. These can burst and crust over. Burning or stinging sensation on the skin. Symmetrical pattern. The rash often appears on both sides of the body in similar locations. Associated gastrointestinal symptoms. While not everyone with DH has symptoms of celiac disease, some may experience diarrhea, bloating, or abdominal pain, which are typical signs of celiac disease. Causes of dermatitis herpetiformis. DH is caused by an autoimmune reaction to gluten. When a person with DH eats gluten, their immune system produces IgA antibodies that mistakenly target the skin, particularly the dermal papillae, the upper layer of the skin. This immune response leads to the development of the rash. Factors that may contribute to DH. Genetics. Like celiac disease, DH has a strong genetic component. People with DH often have certain genetic markers, such as HLA-DQ2 or HLA-DQ8, which are also associated with celiac disease. Gluten sensitivity. The ingestion of gluten triggers the immune response that leads to DH in genetically predisposed individuals. Celiac disease. Nearly all individuals with DH have some degree of intestinal damage consistent with celiac disease, even if they do not have significant digestive symptoms. Diagnosis of dermatitis herpetiformis. Diagnosing DH involves several steps, which typically include skin biopsy. The definitive diagnosis of DH is made through a skin biopsy. The sample is taken from the edge of the rash and examined for IgA deposits in the skin, which are characteristic of DH. This is done using a technique called direct immunofluorescence. Blood tests. Blood tests are used to detect antibodies associated with celiac disease, such as anti-tissue transglutaminase (TTG) antibodies, anti-endometrial antibodies (EMA), anti-diamidaviglyopeptide (DGP) antibodies. Intestinal biopsy. If celiac disease is suspected even without digestive symptoms, an intestinal biopsy may be performed to check for damage to the villi in the small intestine. Treatment of dermatitis herpetiformis. Treatment for DH focuses on two main approaches: medication to relieve symptoms and a strict gluten-free diet to manage the underlying cause. Gluten-free diet. The cornerstone of long-term management for DH is a gluten-free diet. Removing gluten from the diet reduces the autoimmune response, leading to a resolution of both the skin and intestinal symptoms over time. It may take months to years for the rash to fully resolve after starting the gluten-free diet, but sticking to the diet can prevent new outbreaks. Medications. Dapsone. This is the primary medication used to provide rapid relief of the itching and rash. Dapsone is an antibiotic with anti-inflammatory properties, but it does not address the underlying gluten sensitivity. Regular monitoring is required due to potential side effects like anemia. Sulfathiridine or sulfamethoxypyridazine. These are alternative medications for patients who cannot tolerate dapsone. Medications should be used under close medical supervision, especially as long-term use of dapsone can have side effects like liver toxicity or neuropathy. Topical treatments. Topical corticosteroids. These can help reduce inflammation and itching, though they are less effective than systemic treatments like dapsone. Complications of dermatitis herpetiformis. If left untreated or poorly managed, DH can lead to complications, including chronic skin damage. Repeated scratching can cause skin damage, scarring, and infections. Celiac disease-related complications. Since DH is associated with celiac disease, untreated gluten sensitivity can lead to complications like malnutrition, osteoporosis, or an increased risk of certain cancers such as lymphoma. Dapsone side effects. Long-term dapsone use can cause serious side effects like hemolytic anemia, liver problems, and nerve damage, peripheral neuropathy, making regular monitoring important. Living with dermatitis herpetiformis. Managing DH involves strict adherence to a gluten-free diet. This is essential for both skin and intestinal health. Avoiding gluten-containing foods such as wheat, barley, and rye can help prevent flare-ups and improve overall health. Regular follow-up care. It is important to have ongoing monitoring by a healthcare provider, both for managing DH symptoms and for ensuring proper nutrient absorption, since untreated celiac disease can affect nutrient uptake. Patient education. Learning to read food labels carefully and avoid gluten is critical. In some cases, working with a nutritionist who specializes in gluten-free diets can be helpful. Conclusion. Dermatitis herpetiformis is a chronic skin condition linked to gluten sensitivity and celiac disease. While it can cause intense itching and discomfort, it is manageable through a gluten-free diet and medications like dapsone. Early diagnosis and treatment are important for improving quality of life and preventing complications. With the right approach, individuals with DH can lead healthy, comfortable lives.